Ever feel like you're doing all the right things and still wondering why your body feels off? You eat well, you train hard, your labs say you're fine, but deep down you know something's slipping. You're not alone and you're not crazy. I'm Daniel Rasmussen, founder of Echelon Center for Longevity, and I've spent 2 decades helping high performers like you to reverse aging, reignite vitality, and finally get answers. On Unbreakable Vitality, we go upstream. We talk peptides, stem cells, precision diagnostic testing, reversing the age of your arteries, all the innovative science-based tools to take back your health span so that your next decades are your best yet. Because aging is real, but decline is optional.
Most people assume that standard heart tests like cholesterol panels, EKGs, or stress tests are enough, but those tests were designed to catch advanced disease, not prevent it. This episode walks through the Echelon Advanced Cardiovascular Panel, explaining how each biomarker reveals the why behind vascular aging and plaque formation. What if your clean bill of health was based on the wrong tests? You go in for your annual physical, they check your blood pressure, your cholesterol, maybe an EKG if you're lucky. The results come back and your doctor smiles and says, you're in great shape. But 2 months later, you wake up in the ER with chest pain or worse. I see this scenario more than I'd like to admit. Patients come to me stunned, confused, and frustrated because their traditional labs told them they were safe, but they weren't. It's one of those things where you go on, you hear about that person who looked healthy, seemed healthy, and they were the epitome of health. And the next year, the whole floor drops out from under them in terms of their health. Now they're being rushed in for triple bypass surgery. I get it. The system is built on outdated metrics. We've been using the same handful of tests for decades now, tests that were never designed to measure prevention. They were designed to detect damage after it's already happened, when it's too late. In today's episode, I'm going to walk you through the exact cardiovascular panel that we use at the Echelon Center, the one that uncovers what standard labs miss. This panel doesn't just look at cholesterol, it looks at inflammation, oxidation, hormonal imbalance, nutrient status. It helps us find the why behind aging, plaque formation, and performance loss so that we can reverse it. Do something about it upstream rather than downstream. If you've ever looked at your labs and thought, this doesn't explain why I feel the way I do, this episode will change how you think about your heart, your health, and your future. Let's get into it. So let's start with the foundation, the labs that most people believe are keeping them safe. Standard cardiology panels usually include a total cholesterol, HDL, LDL, and triglycerides. Maybe if you're lucky, they'll throw in an A1C or an HSCRP, C-reactive protein. But these metrics were never designed to catch early vascular disease. They were designed to assess population level risk after decades of aging. They're late stage markers, not early predictors. The problem is these tests miss the 3 biggest drivers of plaque formation, which is you want to measure oxidative stress, silent inflammation, and immune system dysregulation. Let me give you a typical example. A 50-year-old executive walks into her annual physical. She's been eating cleaner, walking more, cutting back on her wine. Her LDL is 98. HDL is decent. Triglycerides are fine. The doctor says, keep doing what you're doing. Don't change your lifestyle. You're doing great. But 6 weeks later, she wakes up with chest pain. She's rushed to the ER, mild heart attack. Everyone is shocked. Why? Because they never looked at oxidized LDL. They never looked at ApoB levels, plaque vulnerability, or inflammatory cytokines. This is what we see over and over again. People being told they're fine when they're quietly inflamed, oxidized, and silently heading toward disease. The standard of care hasn't changed in 30 years, but the science has. And if we're not testing for what actually causes damage, we're not preventing anything. In the next segment, I'm going to walk you through exactly what test we do and how it changes the game for our patients. So what we actually need to be testing if we want to reverse vascular aging and prevent heart disease before it starts. At the Echelon Center, we use a comprehensive cardiovascular panel that includes over 40 advanced biomarkers. Each one is selected to identify the true root cause of arterial inflammation, plaque instability, mitochondrial dysfunction, and premature aging. So let's break it down by the category. First, you've got inflammation. We go way beyond HSCRP. We measure P-9, a matrix metalloproteinase that breaks down collagen and signals plaque vulnerability. We measure fibrinogen, a clotting protein that elevates with systemic inflammation, tissue damage, and increases risk stroke. LP-PLA2, an enzyme linked to arterial wall inflammation and vulnerable plaque rupture. These give us insight into how unstable or active your plaques might be long before symptoms arise. They're highly predictive. Next, we look at oxidative damage through oxidized LDL. This is what transforms regular cholesterol into the immune-triggering, artery-clogging kind. It's arguably the most important marker that standard labs never test. Then we got to look at your lipid ratios that actually matter, your ApoB to ApoA1 ratio, which tells us how many potential damaging particles are circulating versus protective ones. LPA is a genetic marker for sticky, inflammation-resistant cholesterol. LDLP, the particle count of LDL, not just the total mass, is a more predictive marker of atherosclerosis risk. Hormone drivers of vascular health. We've got to look at your testosterone, your free and your total. And yes, even you women, low testosterone is strongly linked to increased vascular aging and metabolic dysfunction. Estradiol in men and women imbalances can drive inflammation and oxidative stress. We got to look at cortisol rhythm. We measure this through a 4-point salivary test to assess stress resilience and endocrine recovery. We look at nutrient markers like vitamin D, essential for immune modulation, endothelial repair, and gene expression. We look at your B vitamins and folate involved in methylation and homocysteine clearance. Magnesium in the red blood cell, crucial for arterial relaxation and blood pressure regulation. CoQ10, which supports mitochondrial health and energy production in heart cells. We look at homocysteine. High levels directly damage the endothelium and are rarely caught early in conventional medicine. Together, this panel helps us build a multi-system map of what's accelerating your aging, triggering inflammation, and silently creating cardiovascular risk, all without you feeling a single symptom yet. In the next segment, I'm going to go into how we interpret this data and how we use it to uncover the why behind everything you're feeling or even fearing. So here's how we interpret or uncover it. So once we have all this data in front of us, the real work begins. It's not just looking at numbers in isolation, but reading the story behind the patterns. This is where most traditional practices fall short. They look at each biomarker as a silo, but in reality, your biomarkers are a part of a conversation that your body is having with itself. For example, if we see elevated oxidized LDL, elevated fibrinogen, and a high ApoB to ApoA1 ratio, we're looking at a picture of oxidative damage and vascular inflammation, no doubt. This means we're likely seeing an early stage arterial stress and a vulnerable plaque that can break off and cause problems. Now let's stay on top of that. Cortisol rhythm is flattened. DHEA is low. Testosterone is suboptimal. That's a picture of endocrine fatigue. The hormone architecture that normally protects your vascular system is starting to break down. And then we layer in GI map, a stool test that show gut dysbiosis, high zonulin, low secretory IgA, and now we've got a trifecta: oxidation, hormone depletion, gut-driven inflammation, and this is how we identify root cause clusters. Once we've mapped the terrain, we can begin to treat what's driving the aging process, not just what's showing up in the symptoms. So let me give you a real world case. A patient came to us with normal cholesterol, decent energy, and no red flags, but they were experiencing early fatigue, post-exercise crashes that took days to recover, and subtle cognitive dip. Their Echelon longevity panel showed normal LDL, but high LDLP and oxidized LDL levels, borderline LPA, which should never have been tested before. low testosterone, elevated estradiol, elevated P-9 and fibrinogen, low B12 and magnesium. Put it all together, this was a vascular system quietly under intense stress, compounded by hormone imbalance and nutrient depletion. That's the power of this panel. It helps us find the why. We can look into the future and predict what's going to happen. So we don't waste time guessing, and we don't miss the opportunity to reverse disease before it starts. So now, once we've decoded your personal biomarker story, we get to the part that most patients never experience: precision strategy. We don't hand you a one-size-fits-all protocol or plan. We design a protocol based on your exact biological fingerprint. Here's how it typically looks. If we see oxidative stress, we prioritize mitochondrial support, antioxidant nutraceuticals, and IV ozone therapy to restore redox balancing. If hormone imbalance is the culprit, we use precision hormone optimization, adrenal adaptogens, circadian rhythm alignment, lifestyle changes, diet optimization. If inflammation is present in the GI, we apply GI map guided detoxification, mucosal repair, healing the leaky gut, peptides, personalized food sensitivity elimination, VPC 157, TB 500. These are peptides that are amazing. And if all the three layers are present, we layer the protocol in phases so that your body can adapt and respond in sequential real time. We then build in movement protocols, sleep reengineering, and peptide therapy. We use our EPL Echelon Peptide Lab to address endothelial dysfunction, immune modulation, such as thymulin and thymosin alpha 1, and tissue regeneration using some of the hormone secretagogues, growth hormone secretagogues. But here's where the Echelon approach really stands apart. We retest to verify that we're getting results, that we're moving the needle. At 90 days, we look at the first phase biomarkers: inflammation, hormone resilience, and subjective energy. At 6 months, we rerun the heart threat scan and partial lab markers. At 12 months, we run the full Echelon Cardiovascular Panel, the true age, and a retest of the heart threat scan. So we can see the biological age shift. Most of our patients see a 50% improvement in their energy, a 30% reduction in their weight, body fat mass, a recomposition into lean muscle mass. They have a reduced vascular age and a lower biological age. They have more energy, sharper cognition, better, deeper sleep. Because when you treat the why, not just the symptom, your body responds with measurable reversal. So this episode isn't about fear, it's about clarity, because the truth is you can't change what you don't measure. And if you're measuring the wrong things, you're being misled. The old model of normal cholesterol and blood pressure being the gold standard is dead. It's failed millions of people who looked fine until something broke. There's a better way. You can know exactly how your body is aging, where the inflammation is hiding, and what your arteries are signaling, and most importantly, why it's happening. So when you have this level of clarity, you stop making decisions based on guesses or fear. You start acting with confidence. You get to build a protocol based on truth, and that changes everything. You don't have to wait for a diagnosis to take control of your health. You have options. You don't have to wait for a crisis to prove that something's wrong. You deserve better data, earlier insights, and a system that works for you, not just one that reacts to you. I encourage it. Take the free vascular age quiz at echelon-longevity.com/quiz and learn how our panel uncovers what standard labs miss. On the next episode, we'll talk about oxidized LDL, the hidden culprit behind plaque vulnerability, and why it's one of the most predictive and ignored biomarkers in heart health today. I'll see you then.
If you're feeling like your energy, your edge, or your clarity just isn't what it used to be, you're not alone. But you're also not stuck. Every week on Unbreakable Vitality, we explore real strategies to reverse aging, reclaim vitality, and rewrite what's possible. If today's episode gave you even one insight, pass it on. Then go take the free vascular age quiz at echelon-longevity.com/quiz to see how your body's aging. Subscribe, leave a review, and follow us because your future isn't on autopilot. You are building it and you're just getting started.